Hey, I am back. I tried to tape something a little earlier, but it didn't work out. It didn't work out. But what I did want to do was I want to come on here and talk about mental illness. Mental illness is real. It's 2025. It is real. I just wanted to say that, people that we deal with out here, you, we have to realize that they have a lot of issues. A lot is going on with them. Not only mentally, far as they're imbalanced with chemical imbalances. People take medications, and that's the problem. A lot of them are out here not taking their medication. So these people you get into arguments with, road rage, all this other stuff, all these other altercations, they're not thinking, bro. Y'all gotta realize that they're not thinking. A lot of people think it's like upbringing, ignorance, and they give it bad temper. Well, they give it all these excuses of all these things and not thinking mental illness. The reason I say that is that I've worked with a lot of people here and there throughout my years. I've been working, 40 years. So I've been around a lot of people, and you wouldn't think they had mental illnesses, but the signs are there. Everything is there. Now, a lot of us go, oh yeah, he crazy, she crazy. Yeah, but some of these people are. I've known a lot of people who have snapped for whatever reasons, who had, all these altercations with different people. And before, like I said, you just thought it was just being, plain evil or just attitude and the way they were brought up and things of that nature. But now we got to really reevaluate mental illness and what causes it and how it's affecting our kids. So when they become adults, they're going up, OC over every goddamn thing, you know? So, first of all, you have to kind of admit either that you have it or you know someone that has it. Now, the thing is to get them help. Of course, no one's going to go seek help until they're ready to seek help, because you can sit there and tell someone a million times, hey, you need to go get some help or somebody to talk to you and da 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 da. But it's not going to happen overnight, because a lot of people with mental illness, they don't think they have mental illness. A lot of people that are on medication don't think they need the medication. That's why they stop taking it. And then guess what? Now they're in the hospital, they got to go through all this whole rigor crap, and then get back on their meds, and then try to get back to regular life. Meantime, not only are they losing jobs, losing relationships, they're just doing a lot that's really messing up their livelihood, their life. I mean, I've seen a lot of them. And where I got my experience around mental patients, I was a phlebotomist, drawing blood. So we would have to go draw blood on the psychiatric unit. So we had really like three different psychiatric units, because there are different types of mental illnesses that is caused by different things. We had a psychiatric unit that dealt with more like drug abusers, alcohol abusers. And then we had a psychiatric unit that dealt with people who were born with psychiatric problems. That would be people who were, had autism, different levels of autism, which was fascinating to even know and see. There's different levels of that, which makes sense, but you don't know until you know, right? So also then there was a third unit that were more, this was a psychiatric unit that really, these patients had really psychiatric problems, like a lot of them were like imagining things. A lot of them may have been some type of offender, like sex offender, or had some kind of OCD problem, you know what I mean? And they weren't in their right state of mind and they needed medications to level them out. And a lot of them necessarily weren't born that way. A lot of them, maybe like as time went on, some of them grew into those stages. Some people have been through trauma, because we got to remember trauma can cause mental illness, and a lot of people, they don't pay attention to that, or they don't see it the same way. But trauma can cause a lot of mental illness, and one of the things that I learned, that you had to go and assess the individual, of where they were at in their illness. Like, are they approachable? Can you talk to them? Can you have a normal conversation? Some people, you couldn't have a normal conversation. It was the trippiest thing. They would, you would be talking about what you're coming there to do, and then they'll be talking about something that actually happened to them or some person in their life. And then so what I would always do was I would engage with them and listen, because to me, a lot of times, a lot of psychiatric patients, they just want you to listen. They just want you to listen. And by the way, these things I'm telling you, this is especially for people who deal with, say, people with psychiatric problems, and workers who go into these, say, patient rooms or patient environments, and you have to deal with this stuff. Okay? And overall, I would say, any of you, don't take it personal, especially the workers. Don't take anything that some psychiatric patient is saying to you, any patient, to tell you the truth, don't take it personal. Because you got to remember, especially with a psychiatric patient, especially with any patient, they've just heard that they have a debilitating disease, or they have so many whatever time to live, or they have something that's incurable. Remember, they've just been through something, or they may be healing from something. So a lot of times, a lot of people are still traumatized and still upset or still emotional, and they're going up and down with emotions. So don't take it personal. Everybody, I've seen some workers, they take a lot of things too personal when it came to the job, and it was just unfair to the patient. And I remember when I was going through my phlebotomy class, they was always telling me, don't take anything personal, listen to your patient, don't just like act like the patient is just like really normal, because they're not. They're going through something emotionally, mentally and physically. So always remember that. The people that have relatives or people you have to be more sensitive to these illnesses, because a lot of times we're not as sensitive as we should be to people that do have mental illnesses. We just think, oh, just a little. Back in the day, it was like, oh, that person just a little touched. They just a little touched. Yeah, but now you have people all over the place that's touched, and I think you have more nowadays than you used to. One thing I don't like is that they sort of validate kids at a young age, especially minorities, validate their mental illness, and a lot of them don't have. To me, they don't have mental illness, but because they don't act a certain way, something's wrong with them, And so, if you're giving a child medication at a young age because you think they have something going on with them, guess what? This is going to alter their brains, so by the time they become an adult, they are mentally touched. How could you not be? And then you have people your whole life telling you you are, And then too, a lot of these parents were collecting money, it seemed like, or something, getting something from the government to have their child go through these programs. And, that right there is, so like I was saying before, you have these crooked parents who are putting their kids through these programs, having them take medications and drugs, their drugs, medications, because they feel they have behavioral problems and stuff like that. And then, like I said, guess what? By the time they become an adult, they are and believe that they have a mental illness, and then they probably go through programs, saying, "Well, I have this, I have that." Some people do, and it's unfair to the people that do. It's unfair to the people that are really going through it. You know, bro, it's unfair, and I get you. You people out here that's watching this, that's probably going through stuff. It is unfair to you that other people are taking advantage of these things that you should be benefiting from, and you have others benefiting from it that is not true to what's going on with them. Because you have people who are riding the system using mental health. So I remember back in the day, um, what tripped me out about mental patients for the first time. When I used to work in the mental units, I would go draw their blood, and then so they would be in the mental unit just for whatever amount of time. Once they stabilize them, they have the medications, and they're ready to go back into society. Well, one day during this period, I was taking a bus, and so there was this young lady who, oh, she used to snap out every time you try to draw her blood. And then and she was just like, oh, she was just like really on 10 all the time. Man, it was winter time, and I happened to see her on the bus. On the bus. But the great thing about it, I had a hood on, a hood over my head, a hoodie, and I had a hat, so she really couldn't see, and she wasn't even paying attention. And I was so like, I was floored because I didn't know the routine. I didn't know that people went to these hospitals and went to these places, and then after they got out, they went back into society. I had this notion that they were just too much to go back in society, so they went to a mental institution, because I worked in a hospital, not a mental institution, and it had mental floors and wards and stuff. But I always thought that for a minute there, I was thinking, this is how ignorant I was, because I just always thought they went to some type of other mental institution that was for them. Because I could imagine this person being out on the streets or in society, because if they were acting that way, how they were acting at the facility, imagine if they got on the street and started acting that way with other people. Now, I think the problem comes when you have a person that has a mental problem and they are acting out or didn't take their medications, and they encounter another person that has mental problems. And I think this, a lot of the times, I think that happens. I think this is the clashes that happen. So you have a lot of people with mental problems, and they're all clashing because they don't care. They have just no chill. And so I know you all probably know people like that. And then so, you know, it's like, I mean, they treat going into a mental institution as going, I guess, to jail. If you've been there before, you know the ins and outs, you know the protocol and all that. Because even when I worked at that place, the same people came through. And a lot of times they ended up coming back because they had an episode outside somewhere, right? And then they would call the police, and the police would transport them to the hospital. And then they would get put in the hospital, because I guess this was like a known history of these different patients. And so they would end up back at the mental institution, in the mental ward. And so I got to learn that part, how the system works. If you are a worker and you feel threatened going into any of those units, you have the right to refuse that, even though it's part of your job. Because A lot of times, if you go into a mental unit, you are supposed to have an escort, and if the patient is violent, then you're not supposed to really do anything for that patient until they stabilize or calm that patient down. Yeah, they don't tell you that. Yeah, because they'll get in there. One of the things I hate is when they have security holding someone down, and then you have to work on that patient, and the patient starts getting angry at you because you're trying to do your job and your work, and they're like, "Didn't I say no?" You know. So, a lot of that kind of happens, in these places, and you as a worker have the right to refuse if you feel you are in danger, because a lot of times the patients will act out. And a lot of times they will ask you to do your job while they're holding the patient down. And by the way, too, you never hold the patient down. You are not supposed to do that. You're not, that's security's job or nurse's job or somebody else's job, not your job. So don't be going in there doing all that stuff that these other folks do. So I just wanted to like get on here and kind of talk about mental health situations and issues, and I wanted just to bring an awareness because it seems like no one's talking about it. I mean, I'm not sitting here going, "Oh, you should be aware of mental awareness and da 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 da." No, I'm not. I'm just trying to like say stuff that people never told me about, that I had to learn the hard way for years through my experience or experiencing these different things. I was told don't take things personal, and that was like my say base, that that where I structured how I dealt with patients. That was my foundation. Then I just built all my from my experience everything else on off of that. And I don't take nothing personal when I deal with patients. Now I don't deal with patients, but this was like maybe like 4 or 5 years ago. Right now it's 2025. I don't deal with patients. And they do have jobs in the healthcare field that you don't have to deal with patients. You can, move on from that. But if you do deal with them, always get the report, or the report from the nurse or the doctor or whoever, if it's a clinic or the relative, get a report of what is going on with that person. If you feel something is off, or if they're saying something that's like really out there, because a lot of times, like I said, I go by my experience. I can tell right away as soon as I go in there. And if you be around patients enough, you're gonna be able to do that. Or if you're around someone that you grew up with, or someone that's in your family, or the loved one, or whatever, you recognize those signs. And you recognize someone who has that illness. And a lot of times, like I said, you could be that person. Yeah, you could be that person who has mental issues and is not addressing it. Did I have some on my lip? Why didn't y'all tell me if I had some on my lip? I was sitting here trying to eat these potato chips. I'm not on lunch. I'm actually off. I just needed to find a place to talk to y'all. So, mental illness is real, and if you have children, monitor them, watch them, look, pay attention to them. Even or pay attention to your mother, your father, or anybody that's older that you're around or younger. No matter what, it hits anyone. It can hit anyone. Some people, like when they get older, of course, they go into the Alzheimer's, confusion state, you know, those type things, and you need to know the signs. And a lot of times we'll just kind of say, "Oh, they're just getting older." Yeah, they get it. Yeah, it could be that, but you need to pay more attention and monitor. You know, you got to take care of your people. Any of them. You have people that have mental issues that work in all areas, in any and all jobs, all professions. Just because you're a doctor or a lawyer or a judge does not mean you don't have mental issues. or or a policeman, or a fireman, or you're trying to tell me because you're in a profession or professional that you couldn't have possible mental problems? For all you all know, I could have mental problems. I know you're probably saying, "Oh, he has. Look at the way his hair and his beard and all that." Well, what happened was I just came back from vacation. I'm getting my hair cut and my beard cut tomorrow. Okay, so it's gonna happen. I normally would come back to work with it cut, but I wanted to wait. I was thinking about letting it grow anyway. And then it got cold in Chicago, because that's why I'm at Chicago. And you know it's cold everywhere, but it's got really cold in Chicago. And so it feels pretty good to keep it. So I didn't want to cut it too fast, because I'm like, hey, it feels pretty good on my face, you know. So, but I'm getting it cut tomorrow. Two, I don't like how it becomes uneven and you doing all this, you know. But, but yeah, mental, psychiatric patients or people. So you have that all over the place. That's why we have a lot of people into road rage, a lot of people racing on the freeway, people arguing over the silliest stuff. You may have a coworker that won, yeah. So you can have it. I don't care where you're at and who you are. Some people, like I said, will just develop it out of nowhere, or not nowhere, but just like it'll develop in you over time. And then some people have it from trauma. Some people have it from drugs and alcohol. Some people may have had it from um, what is it like from blunt trauma to the head, um, from years of playing a certain sport like football. You ram in your head. Um, Somebody could have fell on their head. I mean, it's all kind of things. These are good. So next time you talk to people and they're snapping off, wait, not only that, not only mental problems, not taking your meds, but we also have to remember a lot of times people are under the influence of something. They may have taken, you know, illegal meds, or they may be drinking, or have been drinking, or both. So we have to keep that in mind that usually people are sometimes under the influence of other things. So it's not always just mental issues, but that doesn't help. Because when they're under the influence, then all the inhibitions of doing the wrong things is out the window. So please be careful out there. This is for all of you who maybe have forgotten that this is a cray world. And a lot of people are unforgiving, and a lot of people will do you in. So be careful out there. Okay? So peace out. Talk to you later. Bye.